A woman who was told by her doctor to rinse her sinuses twice daily to clear up a chronic sinus infection died from a brain-eating amoeba. The woman, who was 69 years old and lived in Seattle, USA, had been using tap water that she ran through a store-bought filter. She had been doing this for about a year, then developed a rash on the bridge of her nose and raw red skin around her nostrils. She was referred to a dermatologist, who sent samples of the rash to a lab. The lab found an infection with a type of bacteria called rosacea. The woman was treated with antibiotics, but her condition got worse. She developed a strange numbness in her left arm and leg, and then had a seizure that put her in a coma. A CT scan of her brain showed a 1.5 centimeter lesion in her right frontal lobe. Doctors performed surgery to remove the lesion, which they thought was a tumor. But when they examined it under a microscope, they were shocked to see it was not cancerous, but infected with an amoeba called Balamuthia mandrilaris. This amoeba can cause a rare and usually fatal infection of the brain and spinal cord called granulomatous amoebic encephalitis, GAE. The woman was given powerful anti-amoeba drugs, but it was too late. She died a month later. The doctors who treated the woman wrote up her case and published it in the International Journal of Infectious Diseases in September 2018. They warned that using tap water to rinse the sinuses may be unsafe, especially if it is not properly filtered or boiled. They also noted that this is the first reported case of GAE caused by Balamuthia mandrilaris in the USA. The amoeba is more common in warmer regions, such as South America, Africa, and Australia. It can enter the body through wounds on the skin or by being inhaled or swallowed. It can then travel through the bloodstream to the brain, where it causes inflammation and tissue damage. The symptoms of GAE can take weeks or months to appear, and are often mistaken for other conditions. The infection is very difficult to diagnose and treat, and has a mortality rate of more than 90%.